who are giving birth in our level 2s and level 3s. Last 2024, which is last year, 256,238 babies were born. I just want to repeat these figures so you can understand that people have a preference to give birth to where it is near. No one is going to give birth because they've been told to go to level 4 and a level 5. 256,238. In a nutshell, the amount of money that this translates to, because if it was a normal birth and SHA is meant to reimburse 10,000 shillings per individual, this translates to 2.6 billion. Okay. And what we are proposing, because again, there was a roadside declaration in the SHA portal and in the public eye. Let me rephrase this, because you all hold political offices. In the public domain, it is known that people are meant to give birth in your level 2s and 3s. However, formally, these claims are not going through, at least for some of the facilities that are here. And we need to make it extremely clear as one of our resolutions that they need to cut off this issue of that they're giving birth in a level 2 and level 3s out of the question. Because even in their own portal, one of the things that is being paid for is the level 2s and 3s. So one of the resolutions that I'm hoping is going to come out very, very clearly here is that a level 2 and 3, as far as we are concerned, that is going to be a bill that is continuously being incurred on SHA. They have to pay for this. The other part that is there, I want to state facts and figures don't lie. A county like Tana River, West Pokot, Mandera, who the governor is here, there are some facilities, between one facility to the next is 70 kilometers. Now imagine telling a pregnant, niko na nguvu nitafanya hizi vitu, don't worry. Huh? Yeah, no, he thought I was struggling. Okay. Thank you very much, though. But some of these facilities are 70 kilometers apart. Now imagine asking a pregnant mother, you have a choice, either pay cash or give birth at home or travel for 70 kilometers, because what is available here is only a level 2 or a level 3. That becomes a challenge altogether. So I'm hoping that this is going to be an issue that the council resolves on, and one of the issues that we want is the SHA to be able to give it in writing on these particular matters, because legally, as it stands right now, we should be getting the reimbursements. But then roadside declarations are what are causing all these problems out there. The other one is the issue of the ambulatory services. Now we'll all agree that this is, no one is denying on these matters, but all we're saying is further consultations between the Council of Governors and especially counties, because we have some counties. I believe Nairobi is one of the counties that has their own call dispatch center. So if that is the case, what are we exactly looking at? Secondly, we need to be able to agree as well. The former chair of health once stated that some of our ambulances are matatus that have been converted, and it is being used a lot. I was not there when he said, but I saw his, it is being used a lot. So we need to agree. If we are now saying that we want to put up certain, what are the levels? Because the danger that we are also seeing here is a situation whereby all your ambulances, you will have to transfer all your ambulances to your Department of Agriculture and Veterinary Services. Because if they're going to put standardizations and your ambulances have not met those levels of standards, then every one of you, your ambulances, will have to now be used in your ECDs to carry school teachers or something. I'm just stating what it is. There's that danger as well that is there. There's also something else which is also important, so we can make this very clear. What differentiates, what do you define as an emergency? And what is a referral? So let's say, for argument's sake, I am not seeing my neighboring counties. If a county, Kilifi, where I get so many referrals from Kilifi Hospital and Kwale Hospital to Mombasa, do those contribute to be called an emergency? Secondly, what contributes as an emergency if, for argument's sake, someone has come from Pumwani and they want to go to another facility, or someone has gone from a lower facility to go to a higher facility? Does that referral mean it is an emergency, or how is it treated? And I'm told that this is going to be something similar to Uber, Bolt, and Light. So if that is the case, does it mean that anyone can call? How is the level of subject of abuse to this? So you get one person, I'm just giving this chair because it's a reality, it will happen. Someone...
Governor, if I may ask, because the control center is theirs, and they're also allowing the individual single ambulance owner to also to come on board, and they'll also be buying their own ambulances to also, bring them on board. What if they decide whichever ambulances that they pick will not be ours, number one. Number two, after you are held to that standard, because ambulance is a car that's moving, it needs to be repaired, you need to buy fuel. If we start having reimbursement challenges also for the ambulatory services claims, what happens? Are we not going to
Chair, I think we should not go with the argument that what if they choose? Because you see, if they've indicated that this is going to be something similar to, they will give you a direct answer, that this is going to be GPS enabled. That means that it is the nearest available is the one that will automatically pick and everything. But I think the issue that is here is, one, what contributes for it to be called? Two, how do we know that the issue that is actually going to be here is the standardizations. The standards are going to be, there's a fear that these standards will be so high that all ambulances will be declared irrelevant. At least the ones that are existing will be declared that they're actually irrelevant. Third, Chair, I agree with you. What happens when now there's going to be a delay in disbursements? And then even this issue of the abuse of this system. How do you know what is actually an emergency, what is not? What happens when someone is out and he had a weekend out and now the wife is calling him, and if he doesn't get there on time, he's in problems and he decides to call this ambulance? It is very possible. I know of someone who, a Nairobi gentleman, let me not mention names, but a Nairobi gentleman. Chair, the other issue, I think this is number 6, and this is
Chair, on ambulance services, because how do you, because a huge percentage of the ambulance services is inter-facility.
Yes.
It's a huge, and for you to present an ambulance solution that does not include inter-facility referral ambulance services is a problem. That is really the big, if you come to my facilities, that is from a dispensary or a health center to the sub-county hospital to the county hospital, or from the county hospital to, Moi Teaching and Referral, for example, in Eldred. So, looking out these
I agree with you. I totally agree with you. And this is why, we should not be, these are issues now we're talking amongst ourselves. We all know. It's like preaching to a duck that they need to love water. We all love water because it is affecting all of us. I think we just need to say that this is our resolution. And then the definition of that emergency, and this is why it is important that those regulations are actually going to be done together with us. Collectively, the 47 governors, collectively, the facilities that we all run in our counties contribute the largest amount of people who will actually be using these services. Because ideally, if an ambulance is picked up a sick patient, ideally, that ambulance needs to be able to go to a certain health facility. If someone is called from home saying that I'm very sick and I need to go to a health facility, that ambulance needs to go to the nearest facility. How ambulances of this magnitude are meant to work is that health facility should be able to get something similar to a call center, that there's an ambulance on its way. Now, if they're not going to include us as the counties, how are those facilities going to now be integrated in this whole system? So it's important for us just to be able to put that in our communication as well, Chair.
Yeah, Chair of Health, you know that under fourth schedule of the Constitution, ambulance service is a devolved function. And all this actually was muted, designed, suggested, and is being attempted to be implemented without talking to us is in itself a problem. Because the conversation we've had about this was first come to us, tell us what you want to do, we tell you how it works, we try and marry the two. That has never happened to date. And this is part of the problem I have with these people. I think we move on in the interest of time.
Thank you, Chair. The other issue is the rejection of approved claims. This again goes hand in hand with whatever it is that I stated earlier. We need to be able to see, not only see, we need to be able to come up, each and every one of us, because one of the things that they are rejecting on, I want to give you an example, and the representatives of ours at the SHA board, these are issues that should actually, in fact, the lady from MEDS as well needs to be able to take this. This actually affects you. Let's say, for example, I'm a doctor. I'm not, but if I was to be a doctor in my other life, and I prescribe a certain level of medication that this is what needs to be treated on this person. Basically, the way they're doing the rejection is that they have a team, and that team looks at it and says that this is not the way you should have treated this patient. You cannot have a monopoly of good ideas when it comes to health. It is understandable, and it can be understandable that why are you giving malaria medicine to someone who has come with diarrhea. But some of these things, if you're going to reject, it is only right for your medical officers as well to say that no, my justification for doing this was A, B, C, and D. By the way, I just need to ask, I'm the chair of the health committee, and so far I've only met the governors. But we also need to ask ourselves, are some of these issues as well being raised by the private facilities? Are they? Because you represent the faith-based facilities. So you also have situations where there's rejections, and if that fails, that is it. Kwa hivyo nakubaliana na sisi. Wapi makofi ya faith-based? Mwapigie makofi. The other issue that is there is the issue of now registration of indigents. And this should actually go hand in hand. It is not here, but it was also a resolution we did when we did our meeting. One, we all have community health promoters. Now, I'm aware a county like Muranga was given a flat rate to pay for their community health promoters. Am I right? Or is it something I just read on the papers? For your CHPs, SHA. The indigent fee, yeah.
No, it was mean tested.
It was okay. Because you see, when we're talking about...
It was mean tested.
But then in the process of mean testing, did you get a standard figure for all, or you had to change for every individual?
Every individual. Some paid 800, others 600.
We need to agree on, colleagues. You all have community health promoters here. Now, you need to budget. In fact, the most important thing that is going to affect you here is your budgeting process. So, the means testing for someone who lives in Nairobi and a means testing for someone who lives in Mombasa would probably differ from a means testing for someone who lives in somewhere else. Especially when it comes to the community health promoters. Then also these indigents that are out there, Chair, we need to be able to agree that fair enough, we are paying for our staff, we are paying for everyone else, but what if they give us, they can even do something else. And this is a proposal that we could even agree on. Chair, the Kenya National Bureau of Statistics is very, very clear on how many indigents are in every county. The figures are there. Why don't they just tell us that we're giving the leeway to the county governments to identify? Because whether they like it or not, whether anyone likes it or not, if you wanted to get to the true indigents, it's like looking for a needle in a haystack. How are you going to get them? There are some people who are concentrated in a certain area, but when they're doing their means testing is being done, they end up being realized that no, this person actually should not be, and they're actually living in the ghetto. Some people living in the ghetto, their phones are being used by their bosses for M-Pesa transfers. So maybe what we could propose as one of our resolution is that when it comes to indigents, that every county is given this amount of people. So with that now, the governors say that I want to be able to pay for my community health promoters, I want to go and pay for the people in the Juakali sector, I want to pay for people who are in this and this level. Is that a fair resolution, colleagues? Chair, is that a fair resolution?
Governor, I think on this one, probably what we just need to do, and the board is here, is to negotiate for a lower standardized figure, right? Because trying to mean test for indigents is going to be crazy. It's not going to work. If we're saying 660 is high, and...
But you see, Chair, even that 660,
yeah.
How are you choosing that person for paying that 660? Exactly, but Mary, the question is, me and you both agree on that. My question that I'm asking is, okay, they've agreed and they want to put a figure of 660. Let us, for argument's say that they're not going to accept to reduce the figure, or they'll accept to reduce the figure. That is now neither here or there. The question that is there is, how are these people who are meant to be paid that 660 identified?
You know, if it's us paying, we'll have a system through the ward administrators and our people.
Exactly.
But
CHPs...
now,
exactly. So shouldn't our resolution be that they allow us a certain amount of people? That means the amount of people who will be declared as indigents in Nairobi by virtue of their population has to be higher than the indigents that are going to be there in Mombasa. Even Kilifi and Kwale would have a higher amount of indigents than Mombasa. Should we not say that the governors be allowed, as their input, to be allowed that we are paying for indigents up to this amount of people? So there now, either you pay for your CHPs or you pay for your indigents.
The whole issue of identification of indigents should be left to the counties. That is the resolution.
Is that fair enough?
Yes, and I think already,
The national
By
government
the
has
way,
no
another
capacity.
thing that is also in the Constitution that you can be able to quote on is every county. I know that Makueni, I think, did this. There was that county gross, that's GCP, that you were able to do. And right now, whenever they're doing anything with the Kenya National Bureau of Statistics, there's always the county, gross county. So if that is going to be the case, then let it be a resolution. Yes.
I think one of the proposals would be each and every county had some system of identifying their indigents. And there were county governments that were paying for these indigents. So I think to be
That
fair,
was during the time of NHIF.
yes, which has not changed, is the same thing. So to be fair, counties must be left to decide through their mechanism who the indigents are, but as much as practical, we request that this fee is lowered completely so that it's standardized across all the counties. If you
I
identify
agree.
1,000, you do it. But then, Your Excellencies, if we limit the numbers, each county must be able to know their numbers. But what we need to request from the national government is a limit. If it's 500, they put it at a flat rate, is 500 for across counties for indigents.
Good.
Can I comment?
If they are paying for indigents within a county, they should also provide us with the details, instead of just saying they're paying so many in this county, so that there's no duplication. Sure. Yeah.
Can I comment? Allow me to comment.
Yes, sorry.
Thank you, Chair. I think the first resolution is what has been proposed by Nairobi and my colleagues here, that how, if the county is paying, it is asked to decide. But a second question to be raised by them will be, what is the number per county? I would propose we do have published documents on poverty rates. So therefore, probably we can argue, if let's say County X, the poverty rate is 24% households in that population. Therefore, as long as you bring numbers that do not exceed that published poverty rate of your county, then SHA should assume all those people are indigents. Thank you.
Can we be able to continue? Chair, what we have agreed, is it being done? Is the Secretariat writing the resolutions so that we just finalize it? And maybe I'm just going to ask one person just to be able to just indicate what the resolutions are. We agree so we don't have to go back again to this matter. Is that fair? Okay. Chair, the other issue is the matters of strengthening ICT and regional SHA supportive structures. And I think this thing is also going to be able to affect when they're doing these ambulatory services. When you have ICT systems that are not going to be strong enough, they had the whole idea was to have a whole digital health, a whole arm in totality. And one of the things that we need to be able, I know, when I speak this, it is not the situation necessarily in some counties, but in other counties, especially Mombasa, because we were amongst the first to do the digitization. But there are many counties where this has not been done. You know, the issue of connectivity at level 4s and level 5s.
Chair, I just hope that what Governor Kangata has said is not taken as a resolution. Poverty index is extremely subjective.
Vary.
The method used now, we have what we call multidimensional poverty index. There's poverty probability index, but human poverty index is not being used by community. And so you find, when it's area-based, where you have urban areas, you find a place like Muthaiga has a Madare. A place like Langata has a Kibera. So your thinking is good, but we need to go deeper into HDI to determine that as the percentage of indigents per county. So let us have it as a point of discussion, not as a firm resolution, Chair.
I also want to just re-emphasize, I'll give you one example, Chair. Do you know eating fish, you're considered rich? That's why when you look at Lamu's indigent, Lamu does not have poor people, based on that report by Kenya National, because the people just eat fish. In some places, like where we come from and where Sakaja comes from, someone who drinks camel milk is a rich man. But for where you come from, Chair, camel milk is the norm.
Now, what I suggest, I think we argue on the issue of a flat rate, which is cheaper. Then as to the numbers, that can be negotiated. Yeah, we can take it up. Governor Sharif, I'm giving you another max 5 or so minutes because I also want...
I'm actually going to take less than that, Chair.
Yeah, I want Prof also to present before the minister comes in. We need to also take a position on affordable housing.
Yes.
So,
Chair, I'll take less than that. Yeah. The other issue that is there is the closure of facilities. I'm informed we had a facility that was closed. This is the Ndiwa Sub-County Hospital in Homa Bay. I think what is most important for facilities that are owned by county governments, before they take any drastic action, sometimes, by the way, we also need to be very, very true to ourselves. At times happens that it could be a mistake that was done by a facility in charge or whatever. But since the county has leadership, it is only right that consults the leadership before any drastic action is taken. This will automatically decrease the element of any future political abuse, for any better word on this matter. Lastly, this now goes to this goes directly to the governors. Majority of us have customized the FIF. Katra, remind me, what was the figure of how many counties have not? Is it 9? 4 counties. I know Tana River is one of them. Customizing an FIF. Some, of course, and you're going to expect this to be even worse. Some, of course, is because of we're closing into the elections, so expect that everyone is going to be clamoring for more and more. But with the FIF and national legislation being in place, this is an advice to colleagues. There's some who money is still not going to the facility and it is going to the county treasury, which means that if you do that, you're actually not aligning to the standards and the norms. So it is an advice. It is always good whenever we call out others, let us also rectify ourselves, that we need to be able to make sure that we all follow the FIF. If you're going to consume money from FIF, you're breaking the law. If you use money from FIF to go and buy jerseys for football teams, you're breaking the law. You're breaking the law.
Yeah, but the bigger thing, or rather a big thing, Chair, they keep flagging and embarrassing counties having accounts.
Yeah, that now should neither be here nor there, because that is very, very clear.
And the law provides for that. Can we have
of
a position?
Course. Yeah. I think maybe one of the resolutions we need to also take up is notify the Office of the Auditor General and the Senate as well. Whenever they're going through this, the governor, I think, was it Bungoma? You were put in the papers that you have 300 bank accounts. And the way they reported it was that it is as if poor you, account moja iko na pesa yako, account nyingine iko na pesa nyingine. It was a very, very unfortunate piece of reporting, and I feel for you. Colleagues, lastly, there's an issue of MPDSR, which I will request my predecessor who has been working on this, just to give him two minutes, Chair. Will that be fair enough?
No, this will be shared because this is
Okay.
just to show the maternal mortality rate per county.
Okay.
So what I've asked CEO to
And
do
then,
is to just share
Chair-
with everyone.
Chair, there
We'll
was
have it
an
on your
issue
phones.
that you raised about handing over.
By law, by constitution, you can only be able to transfer a function if you who are seated here sign off. So let us also be very, any governor who signed off understands what their challenges were.
Just project it again, then we'll allow Governor Mutombo to comment on it, even as we circulate it. Because I'm trying to manage time. Project it, then he'll comment on it from here.
Yeah, this is the mortality rate. So, Chair, I wanted to clarify on that issue. And colleagues, we also need to make a decision. We have to make this decision on the equipment. We can, because this might be the last full council meeting before summit. We have to make a decision. We can't just brush it out that equipment has not been supplied. Can we be able to agree? A number of us, equipment have not been supplied. It is the truth. And I'm actually surprised, and I don't know why it is not as part of the issues that we should have discussed today, Chair. Because if equipment is not being supplied, there has to be a reason, and we have to move. You can't be having more people coming to visit your facilities. You don't have the medical equipment. On one part, we have signed. This is the way forward. Can we be able to agree on that?
Let the CEO comment on this. I'm told there's an upcoming steering committee, and I also saw something being done at the port. Please just comment on that, and then we.
Okay, thank you very much, Your Excellencies. On NESP, yes, it is true. Out of the 7 services that were onboarded, one service completely has not delivered even a single machine. This has been raised, and at the council, when we had the last meeting, that has the MRIs and the like, very critical. So they've not delivered anything, and they've not given any indication, but there was a conversation during the health meeting that it was not found viable, but from the council, we wrote to the ministry that since that facility, that service has not been implemented, then we need it to be cancelled so that they go back on the drawing board and see whether they can be able to restructure it. In terms of the other services, I am aware that the vendors that were lagging behind in terms of supplies have reactivated their supplies, and I know for X-ray, for lab, most of the equipments are being delivered this week. But we have a steering committee meeting on a Friday at 11 o'clock. I think after that, then we will be able now to give a comprehensive report on the next program to all the governors. Thanks, and over to you.
By when?
Friday, we have a meeting at 11. So after the meeting, we'll give the report.
And the meeting, you mean for the steering committee?
Yes, with the ministry and the council.
Okay.
Governor, what I suggest, after that meeting, let Secretariat give us a report, and then we take that report directly to summit and demand that we agree on a timeline, because this timeline has been shifting from July, now I'm told, to 31st of December. We need to agree on what happens.
I can tell you for free, not because they have formally informed me, but some of these equipment suppliers, this whole thing is also revolving around SHA. Some of these people who supplied these equipments to us have not been paid. So now they're asking what happens when
consult me. I'll give Shafi. Thank you very much.
What I want us to do is to give Prof an opportunity so that we also try and, because your recommendations are very clear. I'll give 2 minutes to Vice Chair. Just for those who are not in the room, Governor Muthomi Njuki was elected Vice Chair of Council. Congratulations once again. To comment on that maternal mortality data. And then we need to allow Professor to present on affordable housing. The Minister, the PS and his team are here. We need to take our position. On health, the good thing is that we already likely had recommendations there. So we need to move fast. Time is not on our side. Governor Muthomi, please, 2 minutes only.
Thank you, Chair. Colleagues, I want to introduce to you something you may have heard of before. An outfit that was made by, it was born out of our medical officers, let me say all the health workers in the counties being concerned about the rate at which we're losing mothers and newborns in our counties out of reasons that would be avoidable. And that was brought up by the cases that were reported across the counties, and sometimes because of the fact that there is inter-county transfer of mothers who are giving birth. There could be having a case of Nairobi. From Kiambu is the one who is dying in Nairobi, and you don't have anything to, you cannot do anything about how they were handled out there. So what happens in Nairobi, you deal with death, which is registered there, but it had nothing to do in Nairobi. So our staff started having coordination across the counties by having meetings weekly to be able to discuss every death of a mother who was died because of while giving birth and the child. And out of that, an outfit called Maternal Perinatal Surveillance Response, MPDSR, was born. To date, we have almost 27 counties that have that forum where they meet once in a week. And every facility in the county, whether public, whether faith-based or private, with the authority of the governor, are, I will not say exactly forced, but they are compelled to be in that meeting and report the death, why it happened in their facility, the circumstances, and whether it would have been avoidable. And for that reason, the death rate has started coming down. You may realize that of late, when we were discussing about the facilities that are level 2, that are not allowed to conduct births and paid by SHA, that has contributed to the death rate. Now, the perinatal and maternal deaths increasing because of that reason. So this one, we are asking governors to enhance and ensure that we have that unit in your county, the MPDSR, your CECs knows about it. And then, when they're having meeting I know in a few counties, neighboring counties of Tharaka Nithi, we meet on Tuesday at 7 o'clock in the morning. It is actually a virtual meeting where you just join in and listen to what the reports are being made, and you'll be surprised. And we learned this from the governor of Homa Bay. And Homa Bay was able to have almost 1 year without a single death until last week because of that enhancement by you being there and questioning, why is it that an ambulance, which is supposed to be in this facility, was parked in a small facility somewhere without fuel, and the driver could not be found, and we lost that mother? Why is it that the blood unit that was supposed to deliver to the mother, your lab was not ready, yet they knew that there was a mother in the theater? You know, small things that makes people lose life for nothing. And because of that reason, you'll be able to reduce the mortality rate. And I want to say we have a website, where the website for Council of Governors has MPDSR, which has been incorporated in it. And by you logging in and the reporting is good from your counties, you can actually be able to see as a governor the deaths have been reported across in your counties and even in other counties. Lastly, let me say that from January this year to date, we have lost a total of 934 babies. The data is, where is the data, Katra? That one. We have a report per county. You can see, if you go through that, which should be shared, but we had said for the sake of, this is enough to get to the public because sometimes it can be used against you. Yeah? You can be able to see how many you've lost. Some of this report may not be correct because our people are not reporting everything. But with your enhancement, they can be able to report and put into account. We have also said that this should not be used for shaming your staff. It should be used for improving so that they can be able to report more. And then we work on issues that are making us lose lives. Because as a Council of Governors, we have not chosen this as one way of birth control. We are not intending to make sure the babies are born. Let's not have them made. So you can interject early enough instead of having them made and then they are lost at birth. In other words, introduce more birth controls if you're not ready to control the deaths. Thank you very much. Sorry? This is in both public and private and faith-based. Yeah, you have to ensure that anybody who is practicing in your county does not want to report. You have an authority over the hospital because you are the boss for the county. It doesn't matter where you report to in terms of private or public. It is your responsibility. It is your people who go to those facilities.
So the gist of that is that you need to activate this in your county. You need to lead it yourself. You need to have weekly meetings to track, to ask, and to make appropriate interventions to reduce, those rates. It will be circulated to on our wall so that you can see it, Governor Mandera. Prof.
Chair, 1 minute on health before you go to Prof.
Yes. Okay, maybe two interventions.
Yeah. Chair, I listened to the Chair, Committee of Health, and a lot of these problems are perhaps because we don't have an effective representation in the board of SHA. I'm sure the owners of SHA are us counties because we are the major contributors of revenue to SHA through premiums that are paid by our residents and through the money that we pay for the indigents and so on and so forth. And yet, listening to earlier, there was one member representing the counties in the board of SHA. I am not sure even whether that person who is in the board of SHA is in the committee, or two, whether they are represented in the committee responsible for claims within SHA. Because if you are not in the decision-making table, in a board of directors of an organization that we contribute significantly through subventions from our citizens, then you will not see where the money is going. We want to know how the money that goes to SHA is appropriated for the benefit of citizens. This is something that we need to consider, whether we need to make a case for better representation in SHA board.
Chair,
I think that's a very good suggestion. I didn't know that. What do you mean by the claims committee? Is it a subsection of the board? Subcommittees.
There must be a subcommittee of the board.
So what that means then is that our board members should sign up to be members of that claims committee, or what? Don't you choose which committee to join?
Yes, Your Excellency. And I'm in that committee.
You're in that committee? Yes. Okay, we're already represented there. So later on, we'll give you an opportunity to respond to some of these things. Governor Khalif.
Thank you, Chair. I think we have been having a very good resolution every time we meet as Council of Governors. And the issue of SHA has been repeated severally. We cannot talk of improving maternal death if the way SHA is behaving continues. A good example, in our level 2 and 3, from January to July, we conducted 1,000 deliveries, unclaimed. Now, what will happen if we turn back those mothers? Because SHA don't pay their reimbursement. 1,000 lives lost, or close to 20% of it lost. Because in northern Kenya, Chair, you come from that area. For example, in Mandera, we only have 7 level 4 hospital and 1 level 5. The rest, the 220-something health facilities are level 3 and 2. If these issues are not going to be addressed in the next summit, I think then we should pull out of SHA. Thank you.
Governor, I hear you, and this is what I was referring to when I was up there, that, you know, these are matters that we actually called the CS and his team, and we agreed that, policy position that they took, which was impulsive, if you ask me, you know, because it was not really based on anything, and which was not done in any consultative manner, be reversed. And the minister had actually agreed that that will be reversed. It's now, I don't know, some odd 4 months or 3 months or whatever time. It hasn't happened. This will definitely be on the menu at summit. I hope that we'll find a way forward for this. Now, Prof, I know we're not being fair to you, but because the other team is here, please highlight for us up there what the issues in affordable housing are and what you recommend as a committee. I think, and then after that we'll have one joint communique after we have an agreement, hopefully with the minister, with the PS, I don't know whether it's the PS or the minister that's here, and the Board of Affordable Housing. We'll have one joint communique on both the SHA matters and on affordable housing. Prof, it's your floor.
Mr. Chairman, thank you very much. I think we should be very brief because I think issues of affordable housing is known to all the governors, and I'm quite sure that certain questions are being raised. So I'll ask Nick Mbwika to put on the board there the key issues that we want to raise today regarding the implementation of affordable housing programs in all counties. Every governor is aware that we have an Affordable Housing Act and affordable housing regulations. These are the 2 legal instruments that are governing affordable housing, which every one of us should be aware of, and from them come the issues and the issue of implementation that we are going to talk about. Now, one of the things that we know is that quite a number of governors, including myself, when affordable housing was being done, you just saw it being done by the national government, and there was very little consultation on that issue. So let me ask Nick Mbwika to give you a brief presentation on my behalf on some of the key issues affecting Affordable Housing Act and some of the background to those key issues and some of the issues that we want you to respond to so that the approvals of this affordable housing program comes from this council rather than from somewhere else. So, Nick, are you ready?
Yes, Your Excellency.
Okay, go ahead.
Good afternoon, Your Excellencies. Allow me to take you through the issues that have been deliberated by the Lands, Housing and Urban Development Committee on behalf of our chair. But before I talk about them, I was supposed to go through the act. Allow me not to go through the act, I just go through the issues. So the issues that we have is that counties have been able to dedicate affordable housing land, county public land, for affordable housing. And there's a question of conversion of this county public land into private under the Section of Properties Act. The other issue is around benefit sharing. What is the county getting from this project? The third issue is about the physical and social infrastructure that should support this affordable housing. And the last issue that we have is with regards to development approvals by county government in line with their plans. So to begin with, this is a national government flagship project that requires cooperation and consultation between the two levels of government. Counties have been requested to identify land and dedicate it for affordable housing, and counties have been able to dedicate this land for affordable housing. Upon completion of these projects in some counties, the developments will be converted into sectional units under the Section of Properties Act, which will grant individual ownership of this. One of the issues that has come up in the public is that the public land is a public asset, and so the process of conversion of this land to private lease ought to follow the Constitution, the Land Act, the County Government Act, and the Section of Properties Act. And also, the other issue that has also come up is that counties hold county public land in trusts of the people of that particular county. There is also an issue of, upon completion of these projects, counties take up the responsibility of provision of services and attendant infrastructure. This includes solid waste collection, provision of water, street lights, storm drainage. This responsibility is being handed over to the county governments. Key issues that we have realized as a secretariat, and we worked with the county executive committee members. We have been here since Monday and Tuesday. The first thing is that as counties were dedicating this land for affordable housing, there was no due diligence that was done. And some of the properties that counties have identified have a lot of encumbrances, court cases, encroachments, and all that. The second one is that the land that has been dedicated for affordable housing by counties has not undergone planning and redesignation of the use. Most of the uses you find, they are either educational uses, sports uses, and other uses, yet they have been dedicated for affordable housing. Survey has also not been done, and also the public participation in an allocation of that land for affordable housing did not happen. And cumulatively, counties have been able to dedicate, and I'm using the word dedicate because the legal process of allocation was not followed, 540 acres of county public land. And out of those, only 90%, 46 parcels are titled. The rest are not titled. The third issue that we have flagged out as a technical team is that this is a substantial transaction of conversion of public land to private use, and the Land Act under Section 9(4) requires county assembly approval if you have to convert this public use into private use. And you also need the consent of the National Land Commission or the approval of the National Land Commission to allocate this public land, because the National Land Commission is the entity that is responsible for management of public land on behalf of the two levels of government. So as a secretariat and through the CCMs and the chairs of the committees, we have a recommendation where the projects have already been undertaken and we have the affordable housing units, we have to regularize this process. And this as a responsibility vested in county government, because we're in charge of planning and survey. We're also in charge of getting the consents. And the other recommendation is that the Affordable Housing Board has to take care of these costs for regularizing the affordable housing projects that are already in place. Moving forward, through the CECs and the committees, we are recommending that, because under the Affordable Housing Act, county governments are the first implementing agencies. And what is happening is that counties are giving the State Department for Housing land, a co-implementing agency, instead of ourselves undertaking this implementation. So we are asking the council to pass a resolution that moving forward, the Affordable Housing Board funds county governments to implement this project, and we are taking an example from Nairobi County that is already doing it. Then the other issue, the basis for this, we are recommending that you need to lease this land to the Affordable Housing Board so that counties remain the lessor. And the advantages of this, one, when you remain the lessor of this land, you will benefit from the annual rent that is supposed to be paid. Currently, counties are not collecting annual rent. If we transfer it to the board, then we will not be able to benefit from this. The second benefit is that property rate, of course. The third one is the reversionary interest. In case somebody does not renew the lease or extend the lease, then the land reverts back to the county government and not to the Affordable Housing Board. And then you'll also be able to benefit from development control and the fees that, the revenue that comes with it in terms of extension and the renewal of the leases. We also have issues with some projects that are being implemented in the areas that are predominantly community land owned. And a good example is in Mandera. We have projects in a place called Ramu, which is majorly under the community land tenure. And the process of conversion of community land to public land is already provided in the Community Land Act. So the recommendation is that we follow the process of registration of community land. We follow the process of getting the community consent to convert that community land into public land. And then we thereafter lease it to the board so that we can process the section of titles. That is really a major issue in areas where community land tenure is the dominant form of tenure. Then the other issue that counties have also been grappling with is that we have not been able to agree with the national government on how does the county benefit from these affordable housing projects, especially when you hand over county public land. Remember, this land was designated for a particular public use, and later, as a county, you will require either to compulsorily acquire this land using your own cost to do those services. So, some of the recommendations that came up in our consultations is that we need to do a value of this land that we are dedicating or leasing to the Affordable Housing Board so that we can determine the contribution of the county governments in terms of this project. Then the other thing is that we need to have a benefit sharing framework. And there are two schools of thought there. The urbanized counties think that the value of the land should be the basis on how much the counties should be allocated as the rental stock. Then the less urbanized, where the property rate is not very high, they think we need to have a standard percentage of how many units should be retained by the county governments, because you also have people who need to benefit as rental stock in your respective counties. So those are the two schools of thought we have. Then that the houses are in Nairobi, but all of them have been allocated to residents outside Nairobi. So there should be a framework. We reserve a certain percentage for the people of that particular county, because bearing in mind that you hold the public land in trust of the people of that county. And to address all this, once we agree with the ministry, we are proposing a standard framework or agreement, an intergovernmental agreement to be signed between the national government and the respective county government, spelling out this. The other major issue is with regards to physical and social infrastructure. For these houses to be attractive and to sell, we must also provide the services. An example is you have some units like in Eldoret, where you will bring about 20,000 people. The water service provider in Eldoret, as we speak today, cannot service that the city of Eldoret. So if we add another 20,000 people, we have to agree for a framework of funding this physical and social infrastructure with the national government, because it is the interest not of the county government, but also the national government, so that we sell these houses. This involves water, sewer line, drainage, roads, street lights, ECDs, and even other national infrastructure like security installations, like police stations and schools. So an area that we have not been able to agree with the ministry, and I think when we meet in the afternoon, we need to agree on how do we fund this. The second last is that the issues of development approvals and alignment with the county plans. If you look at how these projects are being undertaken, you find that the counties are not granting approvals. It's a few counties that have insisted that these developments should come to the county for approvals. And this is very important, not only just for the revenue, but also alignment with the services that are available in that particular area. So currently the ministry is using a provision in section 69 of the Physical and Land Use Planning Act that classifies affordable housing as a project of strategic national importance. This is a very dangerous provision for counties, because they also went ahead and developed regulations and ensured that all national functions are classified as strategic national importance. So even a school, even the CAIPs, any development in CAIPs, you have no authority to undertake development control. So our proposal, our request to the council is that we agree with the ministry, regardless of section 69, the constitution requires counties to approve all the developments. So we ensure that all these developments come to the county for approvals. We can agree on the approval fees. The second one is that we need to seek interpretation of this section 69 of the Physical and Land Use Planning Act, because apart from the affordable housing, it will impact on us on many other projects like the CAIPs, the special economic zones, and all that. Then the last one is the preparation of the 5-year annual investment program and 5-year investment program for the affordable housing and the 1 year. This is the plan that will determine the affordable housing projects for the next 5 years and every year. It also determines the institutional housing, and it also determines the allocation of monies to the implementing agencies. And remember, I've said that counties are the first implementing agencies. And it also defines who implements. This is in the process of preparation, and I think, or the recommendation of the committee is that counties ought to participate in this process, because the plan should go to the cabinet for approval, and then it's also taken to parliament, both houses, National Assembly and the county government. So, Your Excellencies, those are the main issues that we flagged out as a committee, and I thank you for listening to me.
Thank you very much, Nick. Mr. Chairman, there's one issue that we should look at very carefully, and I thought that our committee should meet together with the legal committee to look into this. Because affordable housing is already going on, and some completed, without observing some of the issues that we raised here. Supposing, for example, that now in Kisumu, the affordable housing estates that are completed, an apartment block begins cracking. What do we do? Because we are responsible as a county. Citizens will ask you, but when this thing was being built, where were you? Did you approve it? The Department of Land approved the building of this affordable housing. I think we are in a crisis, to tell you the truth, because in my county, for example, I just saw the things going on, and you couldn't oppose it because people also want housing. And if you tell them that this thing started without consulting us, they think we're crazy. So I think county should issue development permit and occupation certificates only after verifying compliance with approved plans, building codes, and environmental requirements. I don't think that in many countries this has been done. So I think this council is being caught with its pants down, really. At least me, I feel that way, that things have been going on, which should be good. But because we have not been in the driving seat, we may find in our hands a crisis that we never expected. So I hope that together with the legal committee, we could guide or we could come to a position where the Chair. But who is that?
That is Abdul.
Can Prof finish, please? Let Professor finish. Professor.
Oh, I thought he had...
yes, sure. I think when you were speaking, I didn't intervene, so please. Anyway, so I'm just saying that although we are acting in retrospect, it should be important that we act quickly so that this affordable housing thing doesn't embarrass us, really. I think housing is good. People need housing. But some of the issues that are raising here are very pertinent in making sure that as we go on, we correct what has happened in the past and we lay good ground for to say what is happening, what's going to happen in the future. Thank you.
Governor Mtula, I will not ask you to withdraw and apologize. This is a Council of Governors meeting, not an audio meeting, but go ahead.
Chair, can he declare his party, please?
Our party is called Wiper Patriotic Front. Mr. Chairman, this has come full circle. The Legal Affairs Committee raised some of these concerns at the onset. It appeared as if we were opposing the housing, but you can see that it's already a problem. In my case, I must declare that in Wote, they did not step into that premises until I issued an approval, at the risk of being insulted by so many people, but I made sure that an approval was given. Mid-course, there was a problem. The public raised the issue about materials being used, and I then forced them, I stopped them, and we had a material something. We checked. There's something even missing in the presentation. One of the recommendations on the physical and social infrastructure for affordable housing is sewer, drainage, road lighting. Emergency is missing. And that is our function. So what is going to happen if somebody is on the 10th floor and there is a fire, like it happened in Dubai? And in that instance, the document that is approving the building, because the people who deal with emergencies look at the plan. Where is the plan? And the plan is sitting in Nairobi. That is the other problem. The third one is a depository. This information, counties become the depository of these plans for purposes of posterity. So they cannot be at national. Section 69, and I say so because when I was in the Senate, I did 83 amendments to the Physical Planning Act. The compromise was the physical land use. And this 69, the intention of 69 was not affordable housing. 69 was projects like Thwake Dam, projects like Konza, those big projects that are international projects being done by international companies. Not 69, because even park houses, now the approvals will go to national government. So, Mr. Chairman, even without, and I think Nick and through the chair was presenting to say, the word is notwithstanding 69. We must give the interpretation ourselves, that the interpretation of 69 is not affordable housing or markets. The market that was launched recently in Makueni, I refused to approve it. And the reason was simple. The market was in the middle of town, and the building was going to occupy the entire space. So I refused, and I was asked this question even by H himself. And I said, if you have 800 traders in this building and you don't have parking spaces, where are people going to park? I forced these people to go back to the drawing board to actually create a basement parking. So we cannot surrender these positions, because we are not doing so because we want to please anybody, but legally we are the people who should. Planning is a county function, and we can't even say it officially about it. Thank you.
Abdul Samad, please.
Chair, there was a communication that actually was done to myself. I foresaw this a very long time ago. In fact, the communication that came to myself was from both Prime Cabinet Secretary, where he even wrote, and I think, Mary, you are aware of this communication because we started this conversation together, even before this whole affordable housing thing started. There was even the then Attorney General gave an advisory on how these things are actually meant to be. And I tend to agree with what my colleagues are saying, that planning has to be. However, Nick raised an issue here, which is a legal matter. I'm just trying to put myself in someone else's shoes. Chair, is it okay if we speak without cameras? Maybe they can take enough pictures and then...
The cameraman, please, at the request of the governor, please.
Poleni sana, poleni. Chair,
if you're going to leave your cameras, please put them off.
anaweza kutuseti huyu jamaa bwana.
Yeah, or just go with them.